There are many things that affect our ability to absorb medications through our GI tract. And when we take medications by mouth, only about 30% of these micronutrients cross the gut wall. If you give the medication to the patients through the IV, close to 100% is available.
I am a neurological surgeon. I subspecialize in spinal surgery, and I also have been running a concussion clinic since 2010. So, as you can probably imagine, my day-to-day activities is extremely frustrating because I deal with people who have serious problems, and my I have a limited tool chest to treat them, and I actually don't feel like I'm adequately treating either the spinal pain, chronic pain patient or the concussive patient. So, what excited me about this project is the hypothesis behind both diseases, both chronic diseases, is the same. It makes sense. No one's ever really described it that way. It's based on an inflammatory cascade that has gone awry. And that inflammatory cascade has gone awry due to micronutrient deficiencies. I've done some blood tests on some of my patients who have pain complaints and post-concussive syndrome, and there are abnormalities. Um, so that kind of, in my mind, proves the point that our 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 milieu inside our bodies, for some people, it's better, and they seem to get over things quicker, and for other people, there's deficiencies, and they're not able to get better. And when you give a pain patient NSAIDs, which are over-the-counter pain medications, they feel okay, but they still have the problem and they relapse. And when you have a concussive patient, although most of them do wind up getting better within 3 weeks, you have the ones, and I see the ones that linger for months to years. And what are you going to do? Just going to keep giving them sleeping medicines so they sleep better, depressive medicines so they aren't as depressed. But as you know, anyone with depression, you give them antidepressants, they're still depressed. You haven't, maybe not as depressed. Maybe they are able to get out of bed, but you can tell when someone is suffering with depression, even though they're on pain medication. So when you talk about parallel approaches, that's exactly what these modalities are, because the restoration of the micronutrients is the goal of that is to give long term relief of whatever your melee is. You extinguish the inflammatory cascade by giving the micronutrient, restoring the micronutrients that are deficient. But in the short term, we have one for pain. We have one medication that we give to give them relief immediately, and for concussion, we have another medication that we would give, or two medications that we would give to help get over the symptoms much quicker. And like Jamie and I talked about yesterday, they divided clearance for concussion a couple years ago to return to learn as well as return to play, and in particular for my high school and college patients, that return to learn piece is extremely important because unlike work where you can go on disability or you can have extended time off, you miss school, you just fall behind and you're going to have to make that up if possible. So the idea of being able to treat someone for a concussion so they can return to learn faster than they have been before is vital.